5 tips on postpartum urinary retention. Having experienced uterine contraction, tear, episiotomy and other pain of labor, some women will have difficulty in voiding. This is non-obstructive postpartum urinary retention. Postpartum urinary retention is one of the commonest postpartum complications. Women who are unable to micturate until the 8th hour after vaginal delivery, or following removal of catheter after cesarean delivery. It can be diagnosed as postpartum urinary retention clinically. Common causes of postpartum urinary retention. First, the influences of gestation. Due to the loosened abdominal wall and reposition of uterus after labor, the abdominal pressure drops, leading to weak urination strength. Second, prolonged labor. It appears to be the result of pressure from the fetus on the bladder and urethra that paralyzes the detrusor. The symptoms are urethral congestion and edema. The atonic bladder leads to inability to void voluntarily. Furthermore, lumbar anesthesia, episiotomy and analgesics will also cause postpartum urinary retention. The damage of postpartum urinary retention. Postpartum urinary retention increases the risk of urinary tract infection after giving birth. If worse comes to worse, it will lead to postpartum hemorrhage. It is not beneficial to uterine involution as well. The women will get anxious easily. How to relieve the burden of postpartum urinary retention. You can try as mentioned below under the instruction of physician. First, remove the inhibition of micturition with conditioned reflex. When urinating, open the tap and listen to the stream of water. It invokes the urge to urinate. Second, wash the perineum with warm water. The heat of water vapor stimulates the periurethral nerves, promoting the micturition. If both of the methods above don't work, clinically, with acupuncture, the physician can stimulate the acupoints CV6, CV3, CV4, SC28 and GB34 to invoke micturition. Or use low-frequency electrical stimulation to promote detrusor contraction. As to pelvic nerve injuries, stimulate the sacral nerves in the deep pelvic floor with magnetic stimulation of high penetrability to improve the function of pelvic floor muscles and help the patients to urinate.